I am a professor, so of course I have PowerPoint. So my brain doesn't function unless I see a slide. So thank you all for coming. I'm really excited to see snow. It's been several years for me living in New Orleans. So this is exciting. Walking here was not that exciting. But and also thank you to the organizers, Luciana especially, working very hard to set this escaide up. It's my first one, and I'm looking forward to future ones as well. So I didn't quite address the topic because I was hoping that we could actually do more of a dialogue. So I wanted to give you a bit of background on me, because I want to make it about me. Just basically to let you know, give you more of an academic perspective on how we do research and how it's evolved into what we're doing and trying to do with GOARN-research. So my background and the way that I came into research is through the Mano River Union Lassa Fever Network. And I was not involved in putting this together, actually. There are a lot of key people, a lot of partners that had this vision of putting together a research institute that spanned across 4 countries that are in the Mano River Union in West Africa, primarily focused on Lassa fever research. Because Lassa fever is a viral hemorrhagic fever that you can find pretty predictably. And so they viewed this as an opportunity to actually build out more research, clinical training, laboratory research, and laboratory training, and building capacity within these 4 countries. And originally, the network was based in Kenema, Sierra Leone, with the idea that it would roll out into into the other countries. And do these countries ring a bell to anyone? This cluster, right? Okay, stay tuned. So we had a lot of partners. The ministries of health were key, WHO and the United Nations, also especially with diagnostic development, USAMRIID, the US Army, I can never remember, Medical Research Institute for Infectious Diseases, and Tulane was an implementing partner, and this was led by Dan Bausch, who is now the director for the UK Rapid Support Team that I'm sure many of you here are involved with or are aware of. So this is basically the infrastructure that I came into as a graduate student. Eventually, because of political will, other priorities, and often, sometimes even personalities, by the time I came on, it was mostly Tulane and the Sierra Leone Ministry of Health and Sanitation that were heavily involved in the site. So at that point, Tulane had active projects in doing diagnostic development in therapeutics, and then some of the things that I was looking at was actual community transmission of Lassa virus. So this involved rodent disease ecology, good old-fashioned pest management. But some of the things that we got to do, because we had built out this research infrastructure, was do some things that were important to the actual populations that we were studying. And that included provision of diagnostics, although experimental and still research diagnostics. But at the time, there were no other Lassa fever diagnostics available. So we provided those to anyone that was suspected of having Lassa fever. Our research funds also covered patient care for anyone diagnosed with Lassa. And then while we were out collecting samples, we were doing a lot of community sensitization and doing case investigations and contact tracing. So we were trying to kill 2 birds with 1 stone with research funds that were very specific for research and fairly biomedical research. And then we have the West African Ebola outbreak that happened. Here's our epi curve here, and you can see the yellow line is for Sierra Leone, and pretty much that gray circle right there, as things started increasing, just about everything came through in some way or another Kenema Government Hospital, which is where our research was based. So I went from being a postdoctoral fellow at that point, doing disease ecology, to responding to an outbreak. And this is what happened. So Kenema actually was notorious for being one of the most chaotic places during the response. We had a lot of staff members and team members get Ebola and die. It was really transformative in terms of understanding my role as a researcher, but also as a public health practitioner as well. So, you know, I'm happy to go into more details about that. I think about how that personally transformed how I think we should be doing research and meaningful research, especially in low resource settings and the kind of obligations that we have as researchers. But if you want to talk about that. But this pathway led me to GOARN. So Tulane is one of many member institutions that are part of GOARN. GOARN is a network of institutions. Just about everyone involved with GOARN, and I'm sure many of you have deployed through GOARN. Very few people have GOARN as their day job. So a few people here. But most people who are involved with GOARN do it on a voluntary basis. So this was created GOARN was created about 20 years ago to really leverage various institutions that don't have the capacity to respond directly to outbreaks, but have a lot of capacity in terms of resources that could be used to support it. So at this point, GOARN is over 250 different institutions. Some of them are academic institutions, public health agencies, research institutions. But basically, the whole point of it is to engage the resources that are found in these institutions for outbreak response. And recently, GOARN has evolved post-West African Ebola to have some key target areas beyond just deployment of personnel into outbreaks. And so we're building out an alert and risk assessment, doing more training, rapid response, and improving that capacity. But the research is what I'm going to be talking about now. And specifically for GOARN-research, I think this is one thing that we always talk about, right? The building the plane while you're flying it. This is classic outbreak response here. This is what we say we often have to do while we're responding in outbreaks. But after 20 years, we keep saying this. And there's only so many times that we can use this as an excuse for not doing things right and proper. So I think this illustration is interesting because there's a lot of activities, a lot of people doing things here, but there's one guy who's sitting there and writing stuff down, right? This is something that I don't think we do very well in outbreaks. We're all running around trying to be useful. And I think most people who respond to outbreaks are incredibly motivated by just being useful. So very few of us actually take the time to write things down. And this is the foundation of research. So what is outbreak research? And I stole this from Amrish, so thank you. Tweaked it a little bit. But so we've decided with GOARN-research to actually take a very, very broad perspective on how we define research. So what we're doing is basically documenting, and that includes sharing and disseminating knowledge, evidence of best practices, and experiences from the field. So if you take the classic EPI curve, this is from the West African Ebola outbreak. So there may be some things, gaps in knowledge, that prevent us from giving the best evidence-based response. And those can trickle up, and those become research questions too. But there are other things that we can actually mine from our experiences in outbreaks. And a lot of those are bottlenecks. Anyone who's responded to an outbreak knows that a lot of the functionality and effectiveness are just different bottlenecks, operational bottlenecks that occur that, when addressed, those are research questions. And then finally, successes. Successes that may happen in one area that then need to be filtered up, maybe tested to whether or not they're scalable. These are all research questions too. So the difference between what I showed you before in a very academically driven research priorities and agenda is that with outbreak research, we don't know what the questions are until we get there. So that is a huge shift in how we approach research and how we leverage our funding and how we get funding. If we don't know the question, most funders will not give us money. All right. We also need these results right away. These results can possibly shift how the response happens, how the epidemic unfolds, and lives that can be saved. So this is critical. So we can't wait until a peer-reviewed paper comes out. Third, we need to package it in a way that can be quickly adopted by incredibly busy people who have very specific things that they need to do in an 18-hour workday. So what outbreak research is not or shouldn't be is a means to publish or to build your academic career. It shouldn't be a pathway to advance or make new technology relevant. That certainly doesn't mean that technology can't improve outbreak response, but that's not the reason why it should be put in place. And it should definitely never be something that takes away from resources for operations and response. So sometimes the research that we do in outbreak research is very conventional. It's what I like to call pragmatically innovative. You know, this is thinking outside of the box of a system, perhaps tweaking a system in an incredibly simple way. And that, to me, is true innovation. So these research questions may be unscalable, and they may be very contextual and situational. So a lot of times with research, we aim for and shoot for generalizability. That might not be possible as long as we're focused on making sure that the impact happens on the ground in the response. And then finally, a lot of the research that we do is unfundable and unpublishable. So as academics, that is where our bread and butter is and how we're evaluated as effective, these are things that I think that moving forward, we're going to have to address. So GOARN-research, this is what we've built out in the last couple of years. I think that GOARN-research GOARN is very uniquely positioned and well-positioned to actually take on a lot of this somewhat unsexy, pragmatic outbreak research because we're equipped to do rapid response. There's a high level of expertise in this cadre, this network of institutions that we have. And then we also deploy very quickly when there are very little funds and resources available. So early on in the outbreak. So the thing is, GOARN-research does not want to do its research, does not want to do research itself. You know, we want to make sure that response is our biggest priority. And so we've decided that we won't actually do research unless it's operational research to improve GOARN. So some of the objectives that we've decided are to help identify the knowledge gaps that happen in outbreak response right now, any operational gaps, and also filter up those successes. And that's what we identify as research questions. And we think they're very important research questions. Identifying researchers and investigators throughout this extensive network that we have and beyond to execute this research, get these people on the ground, GORN is good at deploying people. That's what we've been doing for 20 years. And then also advocate for this type of research with funders. We also need to make sure that the research findings are operationalized. That means that it doesn't stop at a peer-reviewed publication, it doesn't stop at a report, but it's actually rolled into action that changes how the IPC person mixes the chlorine, how the case investigator will collect data. These are the nuts and bolts of what we want to try to do for results. And then we also want to disseminate this across our network. So it still is in its infancy. Much of this has been led by Gail Carson at ESARIC, who's been an amazing leader and has given a lot of junior researchers a lot of room to grow in this space. And then we've had some great support from the GORN operating support team. And Wellcome Trust actually has been doing a lot of the funding of getting meetings together. And so the support that we've got from them has been really, really tremendous. The activities that we've done so far are just establishing work streams. And at this point, they're very discipline specific. Guiding principles, as well as identifying work stream specific projects. And on the other column, I have a list of some of those. But some of the challenges that we've been facing with this new paradigm shift in how we view research is getting buy-in from people who don't necessarily trust a researcher. So people who are out in the field may not want to give you data because in the past that data has never been fed back into the response. So there's a lot of apprehension about researchers and putting researchers down on the ground in an area that is a crisis, and they're concerned that resources will be pulled. So also there's no one, as I said, with GORN who has 100% dedicated time to GORN or GORN research at this point. So we're working on that. And also facilitating research for others for free conflicts with a lot of the institutional obligations that we have as academic researchers. So some of these things we're still trying to tweak out. How do we make sure that we can give back to researchers that are engaged in outbreak research in a way that will satisfy their professional goals as well? And then also identifying the needs of countries. So we want this to be very grassroots. We want this to be data-driven and research questions driven from the field. And so just on the right, these are some examples of some of the work stream leads. Amrish here, and I think Nina Gobat, she was here earlier. She's been leading the social science work stream. Florian Fucht, is he around? He's here. So he's been leading a lot of the operational research, and I've been doing a few things with One Health as well. I don't know, I think that's it. So yeah, just a little context for you.